Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary, for the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the typhoid fever, diagnosis and treatment. Typhoid fever is caused by the bacterial infection transmitted by ingestion of food or water contaminated with the feces of infected person. The organism is the bacteria of Salmonella species. Other names of the fever being gastric fever, abdominal typhus, infantile remittent fever, slow fever and nervous fever. Transmission. The fever is infection and infection spread through the poor hygiene habits and public sanitation conditions, sometimes by houseflies feeding on feces of the typhoid patients and sit on the food. Symptoms. The symptoms are dependent upon the 4 stages which it is divided into, and each stage lasting for a week. First stage. In the first week, the temperature rises slowly with variable readings. Faggot sign. A relative bradycardia. Third stage. Malaise, headache, cough, epistaxis, blood from the nose, pain abdomen in some cases. Second stage. In the second stage, the patient becomes weak, fever, aches at 40 degrees centigrade or 104 degree Fahrenheit, and relative bradycardia. Dicrotic pulse wave, delirium with agitation sometimes and calm nature sometimes. Rose spots on the lower chest and abdomen. Bronchi, heard in the lung bases. Borborygmi, stomach is distended and painful in the right quadrant where the sounds are heard, called borborygmi. Diarrhea. It is common, passing 6 to 8 stools a day, and the stools are green with a characteristic smell. Constipation. It is also common in some cases. Liver and spleen, hepatosplenomegaly is present with tenderness. Third stage. In the third week, a number of complications occur. Intestinal hemorrhage due to the congestion in the Peyer's patches of the intestine. It is serious but not fatal. Intestinal perforation usually occur in the distal ileum. It is insidious in onset and fatal. Neuropsychiatric symptoms: delirium, picking up clothes and imaginary objects. Metastatic abscesses due to the speed of the pus causing cholecystitis, endocarditis and osteitis. The fever. The fever is still very high and variation is limited. Dehydration started at this stage. Delirium. The patient is in delirium called typhoid state. Some patients may develop macular rash on the trunk. Fourth stage. Stage of recovery. Fever starts to come down and recovery is started. Diagnosis. Diagnosis is made by culture of blood, bone marrow or stools. Vidal test. It is negative in the first week and positive in the second and third weeks. In this test, demonstration of Salmonella antibodies against antigen O, somatic and H. flagella TLC, leukopenia, decrease in circulating white blood cells, differential count, eosinophilia, less number of eosinophils per cubic millimeter and relative lymphocytosis. Liver transaminase. In the second stage, liver transaminase is elevated. Vidal is strongly positive with the anti-O and anti-H antibodies. Blood cultures are sometimes still positive. Third week, platelet count comes down and bleeding tendencies increase. Prevention. Sanitation and hygiene are the important measures to prevent the typhoid. Careful food preparation and washing habits will control the infection effectively. Vaccines. Two types of vaccines are available. The live oral TY vaccine, Vivotip, and the other is the injectable typhoid polysaccharide vaccine, MV1. Both are effective 50 to 80% and given to the travelers to areas where typhoid is endemic. Boosters are given every 5 years for oral and every 2 years for intractable form. Treatment. Typhoid is not fatal when properly treated. The rehydration is the first choice of treatment. Drugs of first choice are ciprofloxacin, cefixime, and recently chloramphenicol is gaining importance as it has sensitive against the bacteria again. Other drugs include ampicillin, trimethoprim, sulfamethoxazole, etc. Amoxicillin may be tried. In severe cases, parenteral form include ceftriaxone or cefotaxime are used with good results. Surgery, usually indicated in cases of intestinal perforation. Some surgeons may prefer simple closure of the perforation with drainage of the peritoneum. In case of multiple perforations, small bowel resection is indicated. If antibiotic treatment fails, cholecystectomy is done, but may not be still effective. That's all about the typhoid fever, and in the next video I will discuss about some other disease. Thank you.